Hi everybody, this is Dr. Robert Berger, and we're back to talk more about the gastrointestinal system. Now this installment we're going to continue on where we left off on the last show, talking about what happens after the food passes through the pyloric area, in other words the pyloric sphincter, the connection between the stomach, the pylorus of the stomach, and the duodenum, which is the upper part of the small intestine. Now, before going on, let me just say that there's a very important hormone that determines how well this food will pass and how well that pyloric valve is going to function, and it's called gastrin. And people have heard of gastrin, but gastrin is actually secreted from the stomach. The antrum, when we talked about that before, the antrum, that lower part of the stomach, is where gastrin is secreted from, called gastric cells. And people say, well, how can you have something like that being secreted if it's a hormone? Won't it get inactivated with all that low pH? And that's very important. You know why it works so well? Because you have mucin that's covering that area. You see, all these cells are protected by mucin. Thank God for that, or else you're right. Though that enzyme, that chemical would probably be denatured by something like a low pH, like 1. So that passes on, and when you have gastrin working right, it relaxes the pyloric valve, which means, when I say relax, it means it allows it to open and close correctly. The problem with a lot of people, when that valve doesn't open and close correctly, is it stays very tight. In other words, it's just tight. It's no different tissue, it's just a tightened tissue. And a tightened tissue, you have a valve that won't work. And so let's just pass it on now to the duodenum. Okay, so we're past the stomach, we're in the duodenum. What is going on there? Well, the duodenum, we know, does not have a pH of 1 or 2. Duodenum needs a higher pH because it's getting to the basic. We're getting more into physiology here, physiologic pH. And so once again, what happens if that valve is not opening and closing right, and too much hydrochloric acid is getting into the duodenum, the upper part, let's say the first 5 to 6 centimeters of the duodenum? You've heard of duodenal ulcers. Very, very common. Well, that is one of the causes of a duodenal ulcer, because look at that. It's an acid that'll burn through anything. Let's face it, you take stomach acid and you put it on a car, the next day the paint's gone. And so just think what it does to the tissue. And that's exactly what happens to the duodenum. And you've seen pictures of the duodenum, you've seen duodenum ulcers. Some of them are very, very severe and many life-threatening, because look, if something eats through the duodenum, that means all the stomach contents and all the contents that are supposed to be inside of your GI tract are out into the rest of the body. And that's not supposed to be that way. And that is one of the problems, of course, when duodenal ulcer breaks or you have bleeding, that once again you're going to get poisoning that can be very, very life-threatening. It can be fatal. So you've got to be very careful with that. So we have to be careful with that. And of course, once the food is in the duodenum, remember, this is the upper third of the small intestine. A lot of absorption goes on there. And so when we're in the small intestine, whether it be the duodenum, the jejunum, which is the middle part, or the ileum, which we'll have to really talk about further installments, because that's a very important part for fat absorption. You know, you have to have the right pH, you have to have the right physiological type of setting in order for these nutrients to be able to absorb, because if you don't have absorption, you're dead. You guys will not be eating, because that's where most of it takes place. And like I said, when we get later on, we talk about the ileum, which is the farthest part of the small intestinal tract. The ileum is where most of your fat, basically all of your fat absorption, your fat-soluble vitamins and things like that take place. And of course, you know right away when people have ileostomies or they're missing the ileum, you see the problem right here. You know, no fat absorption, which causes a lot of problems. So this, we have to understand, the small intestine, very, very important to keep the right pH, keep the right peristalsis, meaning the movement of food, and of course proper absorption, because now we're really into the nutrition part. So we will talk about that on the next installment. And until then, this is Dr. Robert Berger, and everybody have a great day.